you ever wondered why sex doesn't always feel as magical as it should? Maybe it's not about you or your partner, but about your body not being truly ready. Sex isn't just an act, it's a conversation between desire, trust, and connection. Sometimes all it takes is a touch of thoughtful foreplay, a few drops of well-timed lubricant, and enough space for genuine arousal to build. These seemingly small details are the secret to transforming intimacy from routine to deeply satisfying, pain-free, and unforgettable. The first experience, when pain becomes a warning sign. For many women, the first sexual experience can be emotionally charged, a mix of excitement, nervousness, and curiosity. However, when that moment turns painful, it's often more than just first-time nerves. Pain during intercourse, especially persistent pain, is the body's way of signaling that something isn't right. In some cultures, regular gynecological exams aren't part of routine health care, which means many women go years without understanding their own anatomy or being screened for conditions that could affect sexual health. Issues like vaginal dryness, infections, hormonal imbalances, or even structural differences can all contribute to pain. Moreover, psychological factors, anxiety, fear, or shame can make the body involuntarily tense, especially around the pelvic floor, amplifying discomfort. A lack of prior medical checkups can leave these underlying causes undetected. What's important to understand is that pain is not a normal part of sex, even the first time. Seeking a gynecological evaluation early not only helps identify physical conditions, but also empowers women to know their bodies better, fostering a foundation of trust, confidence, and comfort in intimacy. Pain isn't normal. Why seeking help matters. Painful sex, medically known as dyspareunia, should never be dismissed as something to get used to. Unfortunately, many individuals, especially women, internalize discomfort as a normal part of sexual activity, often due to misinformation or cultural silence around sexual health. In reality, pain indicates an underlying physical or psychological issue that needs attention. Physiologically, the body is designed for pleasure, not pain. When pain occurs, it might be due to insufficient arousal, hormonal changes, pelvic floor dysfunction, or conditions like endometriosis or vaginismus. Ignoring these signals can lead to chronic discomfort, strained relationships, and even emotional withdrawal from intimacy. From a medical standpoint, early intervention makes a profound difference through pelvic floor therapy, hormonal treatments, or guided counseling. Most cases of dyspareunia can be effectively managed. Equally vital is the mental aspect, understanding that seeking help isn't shameful but empowering. Consulting a gynecologist normalizes the conversation about sexual pain and opens pathways to both healing and rediscovering pleasure. The truth is simple, yet powerful: sex should never hurt, and your body deserves the care and curiosity needed to ensure it doesn't. The science of arousal and lubrication, turning comfort into pleasure. When it comes to intimacy, comfort is not a luxury, it's the foundation of true pleasure. The female body is designed to respond beautifully to desire, but that response takes time. Physiologically, arousal triggers a cascade of changes. Increased blood flow to the genital area causes the vaginal walls to swell, lengthen, and widen, effectively doubling in size to accommodate penetration comfortably. This transformation doesn't happen instantly on average. Women may need up to 20-25 minutes of gradual stimulation before reaching full arousal. Without that time and stimulation, penetration can feel tight, abrasive, or even painful. That's why foreplay isn't optional, it's biological. Gentle, attentive foreplay allows the body to prepare naturally, creating relaxation, moisture, and elasticity. But even with sufficient arousal, natural lubrication can fluctuate due to stress, hormones, medications, or menopause. Here's where lubricants become a quiet revolution in sexual well-being. A good lubricant reduces friction, protects delicate tissues, and enhances sensation, not because something is wrong, but because it helps everything feel right. Water-based lubricants are safe, easy to clean, and compatible with condoms and toys, while silicone-based options last longer and provide extra glide for those who need it. Ignoring lubrication or rushing arousal can create micro-tears in vaginal tissue, leading to pain, irritation, or infections, all of which can cause the body to associate sex with discomfort rather than desire. True sexual wellness lies in listening to the body, allowing it time to awaken, and giving it what it needs to thrive. Arousal and lubrication aren't just physical processes. They're acts of respect, communication, and care that turn intimacy into something both pleasurable and profoundly human. When Pain speaks the hidden science behind painful sex. Pain during sex is never in your head. It's your body's way of signaling that something deeper needs attention. Behind the discomfort often lies a complex interplay of muscles, nerves, and hormones, a system designed for pleasure that can, under strain, become a source of pain. One of the most common yet overlooked causes is high-tone pelvic floor dysfunction. The pelvic floor muscles, which normally contract and relax to support the bladder, uterus, and bowel, can become chronically tense as if stuck in a constant state of defense. This tension makes penetration feel sharp, burning, or impossible. Another frequent culprit is vaginismus, where the muscles surrounding the vaginal opening involuntarily spasm. It's a reflex, not a choice, often triggered by fear, trauma, or anticipation of pain. The result is a literal barrier that transforms intimacy into distress. Then there's vestibular tenderness, a hormonally sensitive condition affecting the small area surrounding the vaginal entrance, the vestibule. Even light touch can cause stinging or raw discomfort, especially in women with hormonal changes due to birth control, menopause, or postpartum recovery. Finally, pudendal neuralgia occurs when the pudendal nerve responsible for sensation in the genital and pelvic region becomes irritated or compressed. This can cause deep radiating pain in the pelvis, genitals, or rectum, often mistaken for emotional stress. Understanding these conditions is the first step toward healing. With the right diagnosis through pelvic floor therapy, hormonal evaluation, or nerve treatment, pain can be replaced with ease, confidence, and connection. Because sex, at its core, is not meant to hurt, it's meant to heal, connect, and awaken pleasure. The psychology of pleasure, how stress blocks desire. Sexual arousal is as much a mental process as a physical one. Chronic stress activates the hypothalamic pituitary adrenal HPA axis, flooding the body with cortisol, a hormone that dampens sexual desire by disrupting testosterone and estrogen balance. Elevated cortisol also constricts blood vessels, reducing genital blood flow and sensitivity. Research has shown that even mild daily stress can lower libido and delay arousal in both men and women. However, the good news is that mindfulness-based practices can reverse this effect. A landmark study found that 20 minutes of meditation per day for 8 to 12 weeks significantly increased sexual desire, arousal, and satisfaction. Meditation lowers cortisol, enhances body awareness, and strengthens the neural connection between the prefrontal cortex, focus, and the limbic system, pleasure. In simple terms, it helps the mind stay present, not distracted by anxiety or performance worries. Sexual wellness thrives on relaxation, not tension, and mindfulness restores the body's natural rhythm of curiosity, responsiveness, and pleasure. The no-nut November dilemma, when abstinence becomes painful. One listener described developing dull testicular pain after attempting the No Nut November challenge, a social trend promoting abstinence from ejaculation for a month. While short-term abstinence isn't inherently harmful, prolonged suppression of sexual release can create physiological discomfort. The male reproductive system constantly produces semen, and without regular ejaculation, pressure may build up within the epididymis, the tightly coiled tube storing sperm. This can cause a heavy or aching sensation that many men describe as tightness. Psychologically, combining arousal with strict self-restraint can also increase sympathetic nervous system activity, heightening bodily tension. The goal of sexual discipline should never be self-punishment. Rather, it's about understanding one's rhythms and needs. True control means awareness, not denial. If discomfort arises, it's not a sign of weakness, but of the body signaling imbalance. Listening to those signals allows men to maintain sexual health without guilt or extremes. Blue Balls Explained, the science of epididymal hypertension. The colloquial term blue balls describes epididymal hypertension, a temporary and harmless but uncomfortable physiological state. During sexual arousal, blood rushes into the genitals, engorging tissues and increasing sensitivity. Normally, orgasm and ejaculation release this pressure as blood flow returns to baseline. But when arousal is prolonged without release, venous outflow slows while arteries continue supplying blood, creating vascular congestion. The result, dull aching, pressure, or tenderness in the testicles or lower pelvis. Despite the slang term, the scrotum does not literally turn blue. The phrase simply describes the feeling of fullness. The condition is self-limiting and resolves once arousal subsides or ejaculation occurs. From a biological perspective, this mechanism reflects how the reproductive system balances arousal and release. While not dangerous, repeated cycles of high arousal without resolution can reinforce pelvic muscle tension and stress-related pain patterns. The key takeaway? The body thrives on balance, not suppression. Understanding the physiology helps remove shame and encourages a healthier, more informed approach to sexual wellness. When retention backfires, pelvic floor dysfunction in men. Excessive effort to suppress ejaculation can unintentionally cause pelvic floor dysfunction, PFD, a condition where the muscles supporting the bladder, rectum, and reproductive organs become hypertonic or chronically tight. These muscles are meant to rhythmically contract and relax, but constant tension, such as from repeatedly holding in arousal, keeps them in a semi-contracted state. This restricts blood flow, compresses nerves, and can trigger symptoms like testicular pain, discomfort during erections or ejaculation, constipation, or urinary urgency. Imagine flexing your biceps all day. Eventually, they'd ache and lose range of motion. The same principle applies here. PFD is increasingly recognized in men practicing prolonged abstinence or over-controlling sexual reflexes. Treatment focuses on retraining relaxation, not strength, through pelvic floor physiotherapy, biofeedback, and mindfulness-based breathing. Learning to let go, both mentally and physically, restores circulation, sensitivity, and comfort. Sexual health depends not on repression, but on fluid, natural rhythm, the body's language of ease and trust. Relief and responsibility. When to seek medical help. When testicular or pelvic pain persists beyond a few hours or interferes with daily comfort, it's essential to seek evaluation from a urologist. While mild epididymal hypertension typically resolves with time or ejaculation, ongoing pain may point to another issue such as infection, hernia, or nerve irritation. Self-diagnosis can overlook these possibilities. A professional assessment includes a physical exam, ultrasound, and discussion of symptoms to ensure there's no underlying pathology. In many cases, reassurance and education are enough, but persistent discomfort may benefit from pelvic floor therapy or anti-inflammatory strategies. Importantly, sexual health is part of overall health. There's no shame in seeking help. The longer discomfort is ignored, the more likely it becomes associated with anxiety, which can amplify pain perception. Addressing the issue early restores confidence and prevents chronic tension. Listening to your body and consulting a qualified clinician isn't weakness, it's self-awareness in action. Testosterone and PSA, decoding the misconception. A 68-year-old man noticed his PSA, prostate-specific antigen, levels rise after testosterone therapy and feared it signaled prostate cancer. For decades, this was a common concern until recent data clarified the link. Testosterone replacement therapy, TRT, restores normal hormone levels in men with hypogonadism, improving mood, libido, and energy. Historically, physicians avoided TRT due to fears it could feed prostate cancer. However, large-scale trials such as the Traverse Study 2023 demonstrated that testosterone does not increase prostate cancer risk or cause abnormal PSA elevation beyond physiological variation. What often happens is a transient PSA increase when testosterone fills androgen receptors in the prostate, a temporary non-cancerous adjustment. Physicians monitor PSA trends, not isolated spikes, to ensure safety. The modern view is nuanced. Untreated low testosterone may actually correlate with poorer metabolic and prostate health. The key is supervised, evidence-based therapy, not fear-driven avoidance. Partnership between patient and doctor. Sexual health is personal, complex, and deeply tied to overall well-being. Hormones, nerves, emotions, and relationships all intersect, which is why self-diagnosis rarely tells the full story. The most powerful step anyone can take is open, ongoing communication with a trusted healthcare provider. A doctor who reviews your medical history, lab trends, and lifestyle can distinguish normal variations from genuine concerns. In testosterone therapy, for instance, long-term monitoring of PSA and hematocrit ensures benefits outweigh risks. Similarly, addressing pelvic pain or sexual discomfort early prevents chronic complications. The truth is that modern sexual medicine is not about restriction, it's about restoration, restoring balance, confidence, and connection. Respecting your body means asking questions, seeking clarity, and refusing to normalize pain or confusion. At its best, medicine is collaboration, a dialogue that empowers both patient and physician to pursue one goal, a healthy, fulfilling, and fearless experience of your own body. Thank you for listening until the very end. If today's story has gently stirred your heart, whether through an old memory, a present feeling, or something never spoken into words, please leave a like, subscribe to the channel, and turn on the notification bell. Intimate wisdom is where we come together to touch the hidden corners of love, affection, and sexuality, things that may seem private, yet are in fact the very core of happiness. I wish you to always love deeply, live truthfully, and find yourself in every glance, every touch, and every trembling heartbeat. Affectionate greetings.